Hoffield Health Centre. How can I help?
If I go like that,
Yeah.
I can't hear anything.
OK, well, don't go like that.
You still working?
Oh, yes.
Are you?
But since I lost my husband, I'm so glad
Yeah.
to have the extra company of people to talk to.
Yeah.
Some poor soul's waiting for an operation, and he's at table, and I'm taking up the space.
You're as entitled to anyone else, though.
You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy.
The church is absolutely fine. There's nothing wrong there. It's just me. Some days I'm absolutely fine, and another day I am absolutely wretched.
Many of our patients have been coming here for longer than I have been a GP. In fact, some of them have been coming to the surgery since just after the formation of the NHS itself.
We're all living longer. At 65, a man can expect to live for another 19 years and a woman another 21 years.
There we go, sir.
Right.
Yeah.
This is all modern technology for you.
They'll replace us soon, don't worry. You'll have a little robot before long.
Yeah. Well, yeah, you won't be there at all. If you
We'll
just
be
have a-
redundant, yeah.
How are things?
Carpal tunnel, sweetheart.
Right.
I can't sleep at nights.
OK.
I'm getting all through the day as well.
Right.
I saw Dr. Roberts a long time ago. He gave me an injection, a cortisone injection.
Yep.
It's all come back now.
OK. So how is it affecting you?
I'm dropping things,
Right.
can't pick things up.
Ooh, right.
I go with my daughters one day a week for
Yeah.
a meal,
Yeah.
and they got a knife and fork for me, big like, you know. Can't cut things up like,
Right,
you know.
OK.
I lose all sort of feeling in the
And is
thing.
it both hands?
Both hands.
Yeah. And is it pain?
It's a constant pins and needles all the time.
Right.
All down here. At times I get such a pain in
Yeah.
here, and it goes up my arm as well. I don't want to chop it off. If I chop him off, I can't chop him off.
And does it go into all the fingers and the thumb,
No,
or just?
no, just this lot here.
Yeah. Let's have a little look. OK. So any tenderness in the wrist at all?
No, no,
No. OK. And if I bend this back.
no problem. It's probably the ageing process, is it?
God, are you really 92?
I am, sweetheart.
You
yeah.
look fantastic.
Oh, thank you.
I thought, how old are you? In your 70s? Whoa, that's fantastic.
Cherry Arnold, please. I'm usually impressed if people cycle here,
Oh, are you?
but to cycle here through the rain...
Oh, well, it stopped raining. Well, nearly stopped raining.
I was about to be terribly impressed. You should have told me it hadn't stopped
No,
raining.
nearly stopped raining.
What can I do for you?
I've got a sore mark here, and I had treatment for a basal cell carcinoma on my back before, and I want you to have a look at it and see what you think about it.
What's the easiest way?
Yeah.
This here?
Yeah.
Well, I don't think that's a... I don't think there's anything sinister at all. What it looks like is a fungal infection. How long have you had it? Do you know?
When did the last go? I'm going to say a year or so. But sometimes it's very itchy, which is what happened to the one on my back.
Basal cell carcinomas aren't usually as big as this. They're usually raised, and they're also usually 1.5 centimetres. It just doesn't look right for that.
It doesn't look right. That's OK.
The reason I think it's fungal is it's flat,
Yeah.
but it's a bit pink at the outside and paler in the middle.
Yeah.
And that's how they behave.
Right.
I think the only sensible thing is to give you some cream to put on that.
Yeah.
Which is the right thing, if I'm right. And I think it would probably be sensible for you to come back and be seen by somebody.
Right, OK.
I'd be very surprised if it turned out to be another basal cell. It just doesn't look like it.
No, that's fine. It's just that it's worth checking up on these things.
Oh, yes, sure. You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy. Yeah, no, that's fine.
All right.
OK, fine, thank you.
And here's this is something to come here. For some reason, they calculate a frailty score.
Oh, right, OK.
I think it's because of your age, but for no other reason. I have to answer this question about you.
Right, OK.
This patient is mildly frail. Much worse than that, the patient is severely frail. We'll say you're not particularly frail at all. I'm not allowed to put in.
This is a joke.
Yes. If I'm as healthy as this when I get to this patient's age, I shall be doing terribly well. Go away.
Yeah, no, I'm doing really well. That's fine. Thank
Bye-bye.
you. Bye.
Right, so it sounds like carpal tunnel. When you had those injections before, did it help?
It did help, yeah.
I don't personally inject carpal tunnel, but some of the other doctors do here, so we could ask one of them to do it. Alternatively, we could refer you to the musculoskeletal clinic to consider surgery.
Yeah, but at my age, is it worth the surgery?
It depends how much is bothering you. I mean, you seem like a fit 92-year-old, and the fact it's affecting you eating, that's quite significant, isn't it?
Yeah, but if I have that injection,
Yeah.
It might last for a few months, like, you know.
It might.
And in a few months, I could keel over, couldn't I? Like, but if I could have got there, and some poor soul's waiting for an operation, needs that table, and I'm taking up the space.
You're as entitled to anyone else, though.
But yeah, but...
But do you want to try the injections?
I feel guilty taking the time.
Oh, you shouldn't do that. Why don't we then ask one of the other doctors to give it a try? But there is the option, OK? And we're not ageist. The other thing we could do in the meantime is add a tablet called Amitriptyline, OK? Because this is a nerve problem. It's compressing one of the nerves going through the sheath in the wrist, OK? It would be one at night. They do make you a bit sleepy, but then because the pain is at night, it might help. Yeah, I think it's worth a try.
Please.
OK?
Thank you.
There we go. If you take that to the treatment room and they'll see if they can book that appointment for you.
Thank you, doctor.
But if it doesn't work, come back to me and we'll refer you to the surgeon.
Oh. Thank you,
I'm not
doctor.
doing that.
Thank you, doctor.
OK, bye-bye.
Can I help?
Problem with mine? That's for no man. 10:20.
10:20, okay. Ah, I know what it is.
You?
It's next Monday.
Stupid fool. Old age coming. Thank you.
That's okay.
OK, come and sit down. Right, so how can I help?
Well, I've still got this awful pain and it's just about really getting me down. Okay. I've had it, this is going on the 3rd week now. And it's all around here and it keeps me awake at night.
OK.
And it's terrible, it makes me cry.
Oh dear, right.
I'm in agony with it.
So tell me a bit more about the pain.
The burning pain.
Yeah.
And it's all around here and at the bottom of my back.
And does it feel like it's inside your tummy or is it more on the surface?
Right there, and
OK.
on the side.
Oh, right, OK.
But that's the tablets I'm on. That helps a little bit.
I think I need to have a proper look at this again. Is that all right?
Yeah, yes, of course it is.
So if you lie down on there, I'm going to have a little feel and you tell me, is that making it worse or is it...
That's not too bad on my stomach. Yeah, around there, it hurts.
That hurts?
Yeah.
What about if I'm going to push your ribs a little? Is that a bit sore?
That's not too bad, but that is.
That is?
Yeah.
Thank you. And he takes... I'm talking like he's not here. Sorry.
She looks after me well, my wifey.
I've actually got an orchid which I've kept for our wedding anniversary.
Absolutely amazed. You normally kill everything.
You come for the results, is that right?
And you said to come back.
With a witness.
Unless I wear flat shoes, I've got a job to walk.
Why do you wear heels a lot?
My wife won't let me here.
In 3 weeks' time is my golden wedding anniversary, and my wife wants me dancing.
Oh, does she really? All right, we better get you sorted there.
Would you mind sitting up? I just want to have a good look at your back.
You're going giddy.
Oh. Yeah? Got up too quick, I think.
Yeah.
You OK?
It's my age, I'm getting old.
Right.
I can't wear a bra, see?
Yeah. I'm going to press on your back, and I want you to tell me if it hurts.
That hurts.
That was it, was it? That one?
Yeah.
Further down?
Yeah.
Okay, fine, you come and sit down. Right, I think this is actually related to your back, having had a look at it. What it says on the X-ray is that one of your vertebrae, right in the bit where it really hurt when I pressed around there, there's a little, what they call a tiny wedge fracture. So it means that it's a little bit squashed. And this can happen if your bones are a bit thin, which, you know, unfortunately, as you get older, that often does happen. And then the pain I think you're experiencing is coming from that bone out along your lower ribs. The pain from this sort of thing often goes on for about a month to 2 months. And I know, and it just gradually settles down by itself as the bone gets used to the slightly new shape. It does just get better. Would you like something stronger to take at night time to get you a good night's sleep?
Well, those tablets, they make me sleep, don't they?
Yes, you sleep quite well.
They make me sleep, but I'm nearly out of them now, so...
So let me give you some more of these. All right, I'm sure you'll be feeling a lot better.
Well, I hope so,
soon.
anyway.
OK, thank you very much.
Bye-bye.
Thank you.
My husband would like to make an appointment. Yeah, what's the problem? Back. Oh, back. Your back, OK. That Friday morning. Friday morning, 10:40. Yeah, that's good, isn't it? Yeah, Friday morning.
Hang on, no.
Why?
Bed's coming for you.
Coming in the afternoon, darling. And Philip's home all day, and I'm there. Right, that's super duper, lovely.
Right.
Come on, will you?
Lovely, bye-bye. See ya, bye-bye.
Come in, Mrs. Jones.
Thank you. Right, lovely. Where can I put my bits?
Put all your bits on this bit.
Certainly.
And then sit on this chair for me.
Take that.
And you're here for your lithium blood test.
Please. Lovely. Oh, this is all jolly nice.
So how are you today?
Pretty well. It's lovely.
Sharp scratch. Your vein's gone.
You won't believe it. When I had this done in Southmead, somebody spoke to her as she was doing it, and blood shot all up.
Oh, did you?
Yeah, so maybe she's taken it all.
Oh, they are.
Oh, super, right.
So have you got any plans for today?
Yes, I'm going to the hairdressers this afternoon, thank goodness. I should be glad to get my hair washed. Back to work tomorrow, then.
What, are you still working?
Oh, yes.
Are you?
Lovely. I couldn't stay home. I couldn't. No, I enjoy it.
What do you do?
I work on a refund desk. When people bring everything back, I have to check the receipts and mark it in and give them the money back. They're very good, though. They give away quite a lot when sometimes you think, yeah, they've used this a lot.
So how long have you worked there for?
14 years. 7:30 in the morning. Never mind. Gets me out the house. I think that's the main thing, isn't it?
Is it part-time?
Oh, yes, yes. But since I lost my husband, I'm so glad to have the extra company of people to talk to.
Yeah, that's the thing, isn't it?
So there we are. Let's get my clothes on. Thank you.
They should be ready about after 11 on Friday.
Oh, right, lovely.
OK.
Thank you very much. Let's pop this away.
All right.
Thank you very much.
Take care.
Right.
Bye now.
Bye-bye.
Right, do you want a long story or a short story?
I want the story I need to be told. And, I want an interesting story.
Yeah, well, it is interesting because I got this condition called Myasthenia gravis.
I saw that. Yeah.
Last year, I was at work and I'm speaking the way I'm speaking now. This is not my normal voice. And my eye was closing. And I just thought I had sinuses because of my speech. So I went to see my local pharmacy, and she said, I think we all call an ambulance. You don't look well. Got taken to the hospital. My heart was fine. They eventually got it down to that I had Myasthenia gravis.
Myasthenia gravis is an autoimmune condition that affects the receptors and muscles so that the nerve signals that make the muscles contract don't work as well. And what the patients experience is fatigue. Everything's a huge effort. Their eyes don't work so well. They get double vision, and it often affects their speech as well. This is not a terribly common condition. I think this is only the second person I've ever seen with this, and I've been in practice a long time.
So what is happening today? Basically, I want a ESA form. With my condition now, I can't stand for too long. My peripheral vision has been affected.
How much does it restrict you in terms of what you'd like to do?
Everything. Because I said I got no motivation. Then the only way I can describe it to normal people, right, is lazyitis. I don't want to do nothing. I said, because of my speech, people think I'm drunk. So that knocks my confidence, because I said, my job was a CCTV operator and security. And I did that for 14 years, loved every minute of it. And,
but you haven't been able to do it since?
No, but I said, I said, well, get me an alternative.
Okay.
But they gave me like a desk job. I can't focus. I get bored.
Stop.
So, I'm sorry. I do waffle. I apologise for that.
Right. But you only want me to do a form for your work?
Yeah, because I said there's nothing else that you can do, Dr. Jewell. I get very isolated now because I said I don't go out.
But you could go out, couldn't you?
No, yeah, that's what I'm saying. But I love my football. I love to go and watch football. And I never missed a game at home. I only seen one game. That's just bring me down an awful lot.
I think you have to adjust to the state of mind and try and do your best. I mean, I would say, you know, if you want help to make sure you can go to football, go to the club, ask them what they need from us.
Yeah, but again, I do apologise for interrupting. Again, it may seem trivial to you, but I have to go to the club to explain.
Mr. Rista might live for another 20 years or more. And you need to work out what is going to make life worth living.
Exactly.
And do something about it. I agree it's difficult, but it just seems to me that it's important to do the things that will give you a sense of enjoyment. Off you go.
Dr. Jewell,
Nice to meet you.
I appreciate it. Thank you very much indeed. You take care of yourself.
Bye-bye.
Bye-bye now.
Yeah, I'm not supposed to live up your eye lately. I don't know, Hazel. Since I hit 60, it's been downhill, I tell you. I feel like an old crock. Put it this way, the brain don't feel like an old crock, it's the body that is.
Have a seat. Right, what can I do for you?
This business on the eye.
The one right in there?
Yes.
Yep.
I've had one that I dealt with about 2 months ago. Well, I didn't deal with it, dealt with itself. It was right here behind the ear.
Right.
And that one morning, all the thing had burst and come out. So this has been growing at a stronger rate lately than before. It's been there for quite a while.
So would you say it's doubled over how many months, how quickly?
I should have thought doubled over about 6 weeks, something like that.
Right, so that's quite significant, isn't it?
Yeah, it's really.
Is it painful?
No, not at all, no.
And does it affect your vision at all?
Not at the moment.
OK, let me have a closer look. Right, OK. It's about 1 centimetre by 0.6. The way it is at the moment, I think it's a benign growth that's nothing to worry about, OK? Like a wart-like growth, OK? However, the only thing that concerns me about is the rapid growth.
Oh, right.
OK, because that can be a worrying feature. And like you say, where it is...
It's going to, if it does get bigger, it's going to come right into my sight.
Yes, it's a tricky one because for benign skin lesions, there isn't any funding to have them removed.
Oh, right.
Because the NHS, as I'm sure you're aware, has limited amount of funds. So what we need to do is keep an eye on it. Maybe come and see me in another month and I can see how it's changed.
Right.
Okay.
Yes.
As an alternative, if you wanted to have it removed, you could always consider having it removed privately if you wanted to.
Oh, right. Well, it's not causing any bother at the moment, you know, that's the thing.
Yeah. So what I'd suggest, if you don't mind booking an appointment to see me again in about a month, so I can have a look at it again.
Yes, definitely, I'll do that.
Okay.
See you in a
See you in a month. Okay, bye-bye.
Thank you.
Angela Maggs, please. Yeah. So it's been about a year since I've seen you, isn't it?
Well, for the first time in a long while, I woke up, it was about 2 weeks ago, and had a terrific nosebleed for nearly an hour.
Oh, dear.
It was like clots and things.
So it
and
stopped in about an hour, did you say?
Yes, and I haven't had them before. So that concerned me a bit.
Okay.
The other thing, every so often I have sort of a small light thing dazzles, and then a triangle sort of shape of colours, and after about 20 minutes it's gone. I've got a bit of a muzzy head afterwards.
Does it matter whether you close your eyes or not?
No, because I've tried to work out which one it is, but there is epilepsy in my family.
Okay, so you're worried it's something like epilepsy?
Yeah. Well, I don't suppose it, I hope not.
I must say, from your description of it, that sounds much more like migraine than anything else. And you can get the visual symptoms of a migraine without the headache. And that's what it sounds like to me. Angela has been under my care for 10 years, but she very rarely comes to the surgery. In fact, she keeps very good health herself. However, she is the main carer for her husband, who sadly has dementia. And how are you coping with your husband, is it? How's it going?
He doesn't always realise he's in his own house sort of thing, and gets very confused in dressing. But he's been a very good husband and stepfather to my daughter, and the grandsons think the world of him. And if it was in reverse, I'm sure he would look after me.
Do you want to have your flu jab today?
Oh, yeah, if I can, please.
And could you give David a flu jab while he's here? Because we missed it yesterday.
Have you had yours?
Yeah, you gave me mine. I was your first patient.
I'd forgotten that. You're still alive, so... Yeah.
Flu injection.
So I'm just going to put this into your tattoo, if that's all right.
I always get a very stiff arm, but this, I'm worse than the children.
Little scratch.
You ready? Little
Yeah.
scratch. Sharp scratch.
Oh, isn't too bad at all.
We did 200 flu jabs at lunchtime yesterday, which is not the most we've ever done, but it did look pretty busy.
Oh, one thing, hold on. Flu jab.
Oh, yeah. Oh, what a shame. I probably got away with that one.
I want to just have a quick look up your nose. Can you tip your head back slightly? I'll put my glasses on, I'll see better, won't I? OK, sometimes in these situations you can see where the bleeding came from, but I can't in your case. Just want to shine a few lights in your eyes a second. So just look at me, please. OK, can you look at my finger, follow it over here, up here, down here. Do you see double at all when you do that? No. I'm going to look into the back of your eyes. OK, all right. Light's coming on rather bright.
Yeah.
There we go.
Thank you.
So let me just say about the nosebleed first of all. I can't see anything terrible going on up your nose. Your blood pressure is normal. Normally in these situations it's a one-off. So I did a brief examination there. I don't see anything immediately wrong with your eyes. So I think it's migraine. It's nothing to do with epilepsy. OK.
You've been very understanding, and I've taken a lot of your time up,
No, you're
Dr.
taking
Cordell.
exactly 10 minutes, which is what's allocated. That's fine.
Yeah.
OK.
Well,
So,
I find you very easy to talk to.
OK. Well, have we covered everything for today?
Yes.
Yeah.
Yes,
Okay.
I'm sure I have.
Do keep in touch with your husband's surgery, though,
Yes.
about the other, other business.
I know it doesn't help, and it makes things worse. But on occasions, usually in the evening, I have bellowed and screamed at him, and I felt if I didn't, I could murder him. He could, and I say, "Oh, I'm sorry, Derek."
Hard, isn't it?
And I said, "I know it's not your fault. You can't help it, and I can help my attitude to you, but it is hard sometimes."
It's extremely stressful, isn't it, looking after someone who's got that sort of problem.
And you know,
I think most people find themselves getting very stressed at times. So,
yeah. Well, thank you very much for seeing me, Dr.
All right. OK. Now it's been a year since I last saw you. Do come earlier than this if you need to another time.
Well, thank you very much for seeing me. You're very good.
Bye-bye.
Thank you. Goodbye then.
What time's the appointment?
Well, I thought it was 4:15, but he reckons it's 3:45.
Oh, right.
Honestly, we're really confused.
All right. And your name is?
I'm Dorothy Nichols. At least I know that a bit of me.
That's good then. Good start then.
You have to sit there. Sit
sorry,
that one. That's all right. You can sit there if you like.
I'm not taking over. No, thank you very much.
No problem. We could do it that way round for a change.
Oh, no.
How are you doing anyway?
Good and bad, good and bad.
Oh, okay.
I'll give you the good first.
Yes, start with the good. I like that.
Blood pressure, that covered quite a period because there's a week I was away and we've improved a good deal.
So ideally we should be sort of 140 or less, but
That's
we're
right.
getting there. OK, so that's the good bit. So
Now, the thing that's not so good, I've been very tired for quite a long time. I blamed the flu, then I blamed all sorts of things, which I was putting down to age more than anything else
bless
for a very
you.
long time. Now, over in Ireland and Knock, I brought you that. You can, when you've got time, you can read it, see where I've been.
you.
Don't worry about it. It's a little village in the west of Ireland where I worked, where I worked for about 4 years before I came over.
So you went back there
And I was back there for a week, going down the high street, when my doctor, Dr. Murray, stopped this car and he came
What are you
across
doing
me.
here?
That's right. And he asked me how I was getting on, but I said I do feel an awful lot of tiredness. He did say, has anyone ever said anything to you about sleep apnea? I said no, but he said it's more common than we sometimes think. And of course, I did a Google, as we all do these days, and there were a couple of things that did then worry me. One was waking up at night. I wake up to go to the bladder troubles once, sometimes twice a night. But sometimes I have woke up panting. The second thing is a very dry mouth, and it's not a thirst. And the third thing is the legs. It isn't pain, it's more or less a jungling of the legs.
OK. Do you know if you snore?
I don't really know.
Because obviously with sleep apnea, the key is that you're snoring, but you're also kind of breath holding or whatever. And we're not going to be able to get that evidence from you of somebody saying, or, you know, if they're in the same bed with you, they're going to notice that, and they maybe could even time, you know, how long if you were holding your breath. So there's a bit of uncertainty there. There's a score that we could do once we've checked your blood test. There's a score called the Epworth Score, which will tell us what the likelihood is. We don't just go by that, but partly it's about the snoring, but it's partly about exactly, do you fall asleep when you're talking to people, or is it just if you're watching a sort of film and it's late at night, then you might fall asleep sort of thing? Or
I should wake up refreshed, he said, irrespective of my age. That's the key.
No, you're right. But the blood pressure I'm pleased with.
Thanks very much, Doctor.
OK, nice to see you, and thank you for your bookmark. I shall keep that in me BNF. Every time I look at a different medication, I'll think of you. OK, cheerio.
Thank you, bye-bye.
Come and have a seat. OK, so your MRI, it shows a lot of changes, as we thought, in the neck. Lots of disc bulging in a number of levels. And there's narrowing in the canal as well.
Yeah, but
Yeah.
we knew that because that's what's trapping the nerve.
That's right. And lower down on your back. So do you think you're coping with the pain?
Well, most of the time I get days where I can't do anything.
Yeah.
Because even my hands now,
Yeah.
I get days where every time I pick something up, I drops it.
Any numbness or tingling in the fingers or the hands?
I get tingling in my hands when I pass water.
OK. Not sure why that is.
Normally.
Squeeze my fingers.
I've got strength there.
Yeah, good. Pull me towards you. Good. Push me away. Yep, that's good strength.
Yeah.
Yep, let me just get my hammer. Can I just check your reflexes?
Yeah.
Yeah, just relax. OK. So, I mean, one of the thoughts is, do we need to do anything about it at this point? Have you ever seen anyone about your neck?
Well, I went a few years ago.
Yeah.
And they gave me physio.
Right.
The exercise they was giving me, I was in agony when I went with it.
Yeah. I mean, the other alternative is we could refer you to the spinal clinic, see if there's anything they can do about the neck problem.
It depends on what it involves, doesn't it?
Yeah. I mean, we could ask their opinion if you wanted to.
Yeah. I suppose that might be an idea.
Yeah. Should we do that then? Yeah. OK.
Another thing is this ear, it keeps going deaf in it. And
Okay.
I did what you told me not to do and put a blood in, and I've never got so much stuff out of my ear.
It doesn't matter, though. It's healthy to have wax in the ear.
You can't hear anything now. We're stone deaf without you. If I
We'll
went
put drops in it then, because remember the earbud got stuck in it last time,
Yeah.
and I managed to get it out, but another time it might get stuck and we couldn't get it out.
if I go like that,
Yeah.
can't hear anything.
Okay, well, don't go like that. Have we referred you for hearing?
I got hearing aids.
Right, yeah. But you haven't got them in?
No, what I'm on 1-to-1.
Yeah.
I get no problems.
Okay.
Is if I'm in company.
Yeah.
And you get a bit of a rabble.
Yeah.
I can't decipher it. So
Okay.
if I got the things
Right, okay.
in, I'm all right then.
Fine, okay. But please, please, please
Don't,
don't put any earbuds in. Okay. All right, so I'll refer you. See you soon. All right, bye-bye.
I got a blockage, lots of earring in my left ear. I think it's only wax, probably. First time ever, but it always comes. 91 years, not bad, is it?
It's a sit and wait service though, so there could be quite a wait.
Sorry.
There could be quite a wait.
Okay, yes, that's fair enough. You can see what I'm talking about.
Yeah.
I can hear with this one, but not that one.
John Webber, please.
Oh, yeah.
Come on in, come and take a seat.
Can I take my coat off, you don't mind?
Yes, no, that's not a problem.
Thank you.
Do you want to pop it behind the chair? Is that okay? Or you can hang it up on the other.
There you are.
John, you can put it on the peg if you like.
No, it's all right, it's done.
You're not wearing your designer coat then today? Don't care about that one. Okay.
I had to sell that one.
Have you heard from the vascular surgeons at all about the vascular clinic?
No.
No appointment yet?
No.
OK. There's some things that are showing up when you had the Doppler studies or looking at the vessels in the legs.
Yeah.
And that's why I referred you to the vascular surgeons.
Oh, I see, yes.
Who are the specialists who look at the pipe work.
Yeah.
He come in and had his pulses done last Wednesday.
That's right. You saw Sue and your blood pressure's good.
Yeah.
Well, she said it was all down.
No, it's OK, 123. It's a little bit, I mean, how do you feel on it? When you get up, do you feel giddy or anything?
A couple of times I've been like that, you know. But,
Friday, we were out and I took him home.
It's been happening. It's been happening when we're out somewhere, like.
He wasn't as bad as when he was taken into hospital, but he was going that way.
Because of the feeling as if you're going to faint and the blood pressure reading, what we're going to do, we reduce the bisoprolol down to 1.25, and I'll just give you some of those.
Oh, I see, yes.
And maybe check the blood pressure again in 2 weeks after being on it.
Oh, yeah.
Right.
Yeah.
Is it all right if I give that to your wife here?
Yes, of course, yeah.
OK.
I don't know whether you'll agree with it or anything. When I get a packet of tablets, I take them out of the case and put them in a bottle. Does that affect them in any way?
Would you prefer if we set up your tablets in a Dosset box?
Whatever that is.
So you get this kind of pack, a blister pack, and it has all your tablets to take at what time, and you just take them and on the days. Would that be easier?
Well, not really, no. I mean, I've done it myself to try and make it easier. I take the tablets out of the containers, in a sense, and put them in a little bottle, like, you know. So that when I want to take one, all I do is unscrew the bottle, take one out, and gone.
But then we don't know what you're taking when.
Oh, I know. I have them in the mornings, like, you know. I don't take them any other time.
Night time.
I think if you've got your tablets,
Yeah.
it's better to keep them in the packets that they are and take them as you're supposed to. All right? Good. Nice to see you both.
Oh,
All right,
lovely.
good.
Oh, there you are.
I'll get you your coat now.
No, don't worry, sweetheart. That's all right.
Thank you.
Margaret Staining. Come on, have a seat. How are things?
No, not so good. I tried the martesipan, but I'm afraid that knocked me flat out.
Okay.
I was
So didn't get on with it?
No, I was like a zombie. And I thought, I can't be like that.
Yeah, because we've talked a couple of times about how things are really getting you down.
Yeah.
And it seems like that's ongoing.
It is. It's just me. I've got to learn to live with things. And it's very difficult.
Yeah.
It's very difficult.
You mentioned that things were a little bit up in the air with with work?
Oh, no, the church is absolutely fine. There's nothing wrong there. It's just me. It's just me.
Yeah.
And I got to learn to let go. And I'm finding that very, very difficult.
How do you think we could make that easier for you?
What, the letting go?
Yeah.
I don't know. I think that's to do with up here. Some days I'm absolutely fine, and another day I am absolutely wretched. But I know I can't go on much longer. I've got to be honest with you.
Have you done anything that you can think of to injure it?
No, only playing golf. I play 27 holes a week.
So what kind of things do you like to knit?
Cordies.
Yep.
You know, anything. I knit it all for the grandchildren.
I knit, but very, very slowly.
Am I right in thinking you're a ballroom dancer?
Yes, we could be competition dancers, but it's too expensive.
But as long as you enjoy it and it keeps you
We
fit.
enjoy it,
and,
we do, we
yeah,
enjoy it.
Absolutely.
So what have you got planned for the rest of the day?
I watch a lot of television. I got a dog and he likes playing ball.
Aww.
He's always busy. I do the aqua aerobics and he does the walking.
I still put that there swimming.
Great.
Twice a week. Mine, I do more talking than...
More talking than swimming.
Brian Lovell, please.
Hi, here we go.
Hello, hello.
Good evening.
Have a seat.
Hi, thank you.
How are things?
Pretty good, I reckon.
I like to hear that.
Yeah, everything seems to be, well, it just carries on as normal.
Yep. Any problems?
Not that I can think of.
Don't have to try and look for them.
No.
So getting about as normal, going on your holidays?
Exactly. The only thing, I've tended to slow down.
No.
Playing football. Yeah.
Who are you playing football with?
Only the grandchildren.
Yeah.
So it's now got to the stage where Grandad got playing goal.
Keeps you fit then.
I'm a great-grandfather,
Right.
really.
Yeah.
And the other great-grandfather died a couple of weeks ago.
Oh, I'm sorry to hear that.
And the youngest one, the 8-year-old, I've told him I'm slowing down playing football.
Excuse me, yeah.
Told him because I got a bad leg. So he said, if Grandad gets his leg fixed, you only got 14 years to go and you'll be 100.
Thanks for that.
Yeah. No, what can I say? I just feel that I'm lucky.
Absolutely.
Yeah.
Yeah. So, can I just check your blood pressure? So, any chest pains? No. Breathlessness?
Only if I run too far.
Yeah, well, that's fair enough. Yeah, perfect. Right, OK, so just book for a routine blood test when you've got a minute, fit it into your schedule. Fantastic. Well, nice to see you.
Yeah.
Keep playing football.
I haven't seen you a
I know.
long time.
I know.
Anyway, thanks for that.
No problem. You look after yourself.
OK, thank you.
OK.
It can be really hard when you're looking after someone else as well as looking after yourself, and then you also have work responsibilities which are...
I enjoy it.
Yeah.
It's my life. Yeah. That's my solace.
We stopped the mirtazapine. Do you think we should restart the Sulopin then? Because we've stopped prescribing it for you.
Yes and no.
Do you want us to restart it? Because we talked about the potential risks.
This is it, but I don't know what the potential risks are.
When compared to other antidepressants, it is possibly more, puts you at greater risk of heart-related complications. So the options are not being on a medication and thinking about other strategies, talking-based treatments, for example, maybe some counselling, something like that. Trying a third option, a different antidepressant, or going back to it and accepting maybe there's a slightly increased risk.
I don't know. I really don't know. It's all I know is I can't go on the way I'm going on.
Yeah. I guess we have to make a decision, don't we?
Well, what would be the other one you were thinking of?
We could try something called sertraline. Why don't we give that a go?
Stupid I am, really.
There can sometimes be a reluctance amongst older people to talk about their mental health. In the past, there has been a stiff upper lip attitude and the feeling that they were wasting their doctor's time by coming and talking about how they're feeling. My advice is not to suffer in silence, but to come and speak to a doctor about how they're feeling, because there's lots of support which we can offer. Why don't we give that a go? If we're not making headway, then we think about something else.
OK.
If you could perhaps book an appointment in about 3 weeks to catch up again.
OK, thank you very much. Sorry about this.
No.
Bye-bye.
Bye then.
I was up at Tesco's and nuns were outside, so I gave them £4 each. She held my hand and said, "Oh, you have a nice day." I thought, oh, she goes backside, and I went to Euro tonight.
All right?
Yeah, fine. Here we are.
Come on in then.
And I brought my hat in case you wanted to put a patch on top of my head. But there you are.
And how are you? How's your head? Oh, it's looking better, isn't it?
Oh, good.
It's drying up.
Good.
Oh, at last.
Yeah, but it was weeping.
See, all this is lifting off now. It looks nice.
Is it?
Yeah.
Is it skin cancer?
Well, I don't know. What do they tell you?
Well, that's what they said down the BRI about 20 years.
20 years ago?
Yeah.
It was known you men are known for it, you see, because you haven't got much hair, have you, on the top of your head? So you men should always wear a hat, really.
This is the best one, look, because it covers my ears as well.
Have you always worn a hat?
Only when I was on the buses.
On the buses, yeah. Yeah, I don't wear them anymore, do they?
No, I don't never see them now, do you? Not the inspectors.
No. It's quite dry. I'm quite happy to leave it open.
If you leave it open, that's the best treatment for it.
Okay, fine. That's fine by me.
I got to see the cardiac rehabilitation counsellor.
Oh, right.
Sounds good, doesn't it?
Have you seen one before?
Twice I've seen her. She's nice.
Okay. And what do they do?
Trying to get me to find some activity.
Is there anything that you've seen that you'd like to do?
Tai Chi, I did that. That was nice. I made everybody laugh.
I expect you did, knowing you, yeah.
When they said to take like that, and
that reminds you of our Latin American dancing classes. Remember those?
I can remember the square dance.
That's great. Right then, I'm going to see you Thursday then. Oh, it looks lovely.
Oh dear. Oh, me stick. Don't forget me stick. Thank you, sweetheart.
That's all right. I'll see you Thursday then.
Okay then.
Behave yourself. I love seeing the older patients. They've usually got a story to tell.
Beep, beep.
You're doing very well, actually. The most rewarding thing about treating the older generation is that you learn a great deal by hearing their life stories.
Well, I've been a bit worried about it because it didn't clear, so I'm pleased I've seen you now.
I just recommend that you keep interested and keep curious, maintain friendships, and pass on your wisdom to the next generation.
I intend to grow old disgracefully.